Hello, everybody. We're just going to give folks a couple seconds to log in, but I do see everybody coming in. Thank you so much for joining us tonight. We'll get started in about 2 minutes at 7:03. Like I said, just want to give folks a couple minutes to log in here. I know 7 o'clock is it's a great time for a program, but you're likely finishing dinner, stuff with your kids, what have you. So just giving everybody that grace period. So we'll give it 2 more minutes. Okay, still seeing a couple folks log in. Welcome, welcome, welcome. If you're just joining us.
And just had to glance behind me. Normally my two dogs are in here with me and they are not. So there's a chance they're gonna be scratching at the door to get in. We'll see how that goes.
I think my dog is underneath me right now, and I said, "Uh-oh."
Yep.
This could get active. Luckily, I'll be on mute. Hopefully people in our audience know that life, the dog life too, but not a problem. No worries at all. Okay, just 1 more minute and then we are going to get started, guys. Thank you so much for bearing with us again. And we're also happy to see you here tonight. Okay, perfect. Well, it's 7:03, so in the interest of time, I am going to get us started. So hello, everyone, and thank you so much for joining us for tonight's programming, Reducing Lower Body Tic Pain, Moving and Mobilizing. My name is Alexandra Walsh, and I am the manager of programs here at the TAA. And tonight, I will also be your moderator for this program. Participants will have the ability to engage in a Q&A discussion with our presenter at the end of the program. So please feel free to place your questions in the Q&A box throughout the presentation. We also ask that you please take the time to fill out a brief survey at the end of this presentation. I'll display that QR code for you to use with your phones. And your responses not only provide us feedback on our programming, but the ability to host more programming for our adult constituents in the future. Tonight's program presenter is Raquel Cunningham. Raquel is a strength and conditioning coach based in Southern California. Her Tourette diagnosis came when she was 6 years old, and athletics have played a strong role in her tic management ever since. She holds a bachelor's degree from the University of California, Santa Barbara in psychology with a minor in exercise and sports science. She was a competitive swimmer and water polo player before starting her personal training career over 12 years ago at a renowned gym in New York City and then California before going into private training. Kettlebells are her favorite exercise modality, and she is starting to learn American Sign Language with her children. With that being said, I am going to turn it over to Raquel and pull up our slides for tonight's presentation.
Hi guys, I'm super excited to be doing this again. We did one a few months back with Katie Porteraski on upper body tic pain. If you haven't had a chance to look at that one, we cover a lot of tic pain management, specifically focus on upper body. Today we're going to focus on lower body tic pain. And this one was, I had to spend a lot of time editing this down for us to make it digestible information and, more importantly, actionable. I would love for you guys to walk away today learning some things about how your body moves, what happens with repetitive tics, even changing tics, because that is a consideration, and some options to move forward with that. So, first and foremost, not a doctor, I am a trainer. I cannot diagnose or treat Tourette syndrome. This is looking at what happens when like the physical manifestations of our tics on our bodies and what things we can do to help get out of pain. And so if you do have pain, absolutely go see your doctor. There are avenues for that. You can see physical therapists, you can see occupational therapists. There's a lot of avenues. This is just one course of action to address like the muscular reaction to our tics. So let's go into our first slide here. So a big thing today is learning about how each of our bodies move individually and then couple that with your individual tics, right? This is a very individual experience. Even though one person might have the same tic as another, your bodies might operate completely different with the urge, the sensation, and how it actually happens. I put the picture of Chuck Berry up there with that hip twist because I have noticed and worked with people that that hip torque is a more common tic than we realize. But again, starting to learn about how your body moves, what your body's tendencies are without tics, and then how your body moves with these tics and how it changes what our muscles know how to do. So let's go ahead and go into the next slide. So our takeaways today, again, reiterating, learning what your body's tendencies are first. So kind of the hard takeaways are we're going to be learning about pelvic position, that the pelvis can go into an anterior tilt, a posterior tilt, and a neutral in position, sorry, not tilt, but what these positions are and how that can influence pain in your body. And then this concept of foot rooting, having a foot tripod and how that connects your foot into the ground and starts the foundation from the ground up. And there's a big concept that's come to light. Just remember Luke. Luke stands for learn how you understand movement, keep going, and it will be effective. There was an incredible athlete who I had the privilege of working with, and he did not learn things visually. So we really had to kind of figure out how to teach his body movement. And once we figured that out, he flew. It was incredible. And this is him helping me bring this concept to light. So just remember Luke. Let's go ahead and go into the next slide. So with that being said, kind of our overview for how we're going to tackle today is we're going to revisit two themes that we did from our first presentation, reducing upper body tic pain. And two of those themes that we're going to revisit are the joint by joint approach, and that's a guideline for how we can bring our bodies back to kind of optimal functioning and a way for you to assess your own body's tendencies. If you're not sure what I mean by that or how to even start, or even if you are advanced, this is just a really fantastic guideline to always bring yourself back to. So we'll review that. And then this marionette analogy that I love so much, and I'm on the hunt for a specific marionette. So we'll revisit those topics, and then we'll break up today into two sections, the pelvis and how that addresses back, hip, and knee pain, and then the foot, actually, and how that is foot, ankle, knee, and hip pain all the way up the chain. So those will be our two sections that we kind of cover. We can go into the next slide. So with that too, we kind of have a terminology refresh. You know, with living with Tourette's or knowing a loved one with Tourette's, we do have to learn more about our bodies. And so we have to know what these words mean. So when we talk about mobility, that is, and I wrote these down just because I tend to lose my words towards the end of the day. Mobility refers to the ability of a joint to move freely through its full range of motion without restriction or discomfort. So mobility is really referring to the range of motion of your joints and what they can do. Now, some people have generalized hypermobility, where their joints can move beyond what's considered a normal range of motion. And then there's specific categories of that, something like Ehlers-Danlos, which is connective tissue disorder as well. And I bring up mobility too, because sometimes if people have these extra like slippy joints, that can be an urge to tic, to dislocate that or slip it or like move that joint past its range of motion, which can cause pain, which can cause damage. And there are things that we can do that knowing that about your body can help us guide what would be the right exercise choices for you. Flexibility is I mean, I should know this off the top of my head, but I get nervous too. Flexibility refers to the ability of a muscle to lengthen and stretch through its full range of motion around a joint. So flexibility is really talking about your muscles. A lot of the time, people might think that they have tight hamstrings when really it's actually a pelvic instability. And so being able to decipher between is really important. If you find that you stretch constantly and you are not seeing a change, maybe it's a mobility issue instead. And then stability refers to the ability of a joint to remain in a position by a coordinated effort of muscles, ligaments, tendons, and structure. So stability is all of these pieces working together to hold you still. And when you're stable, you can, I mean, we think balance, of course, but you can actually produce more force through stable musculature and then have a better adaptation to your muscles. So having stable muscles can help us target the muscles we are trying to train, which might be the opposite muscles that we're ticking with. I wouldn't necessarily have you strengthen the muscles that you're ticking with because they are being used a lot. So if we can figure out a way how to stabilize this joint, there's this concept called joint centration from a DNS certification that I absolutely love. I think joint centration for some could actually be a way to decrease tic urge. So again, knowing these terms and how we would approach somebody working out or dealing with somebody's pain, that would be a major thing to know. All right, and we can go into the next slide. Sorry, I just opened up the Q&A because I'm curious because I want to answer and know and help. So back here we have the marionette analogy. First of all, if anybody knows how to make marionettes, or if you find a relatively correct anatomical marionette skeleton, please reach out to me and let me know because I've been looking for one. I love this idea of a marionette analogy because it externalizes our tics. And it also gives a visual for these involuntary actions. So there was a question on here, you know, how do you talk to colleagues and friends and other people about having tics? You know, it's these involuntary actions that we don't choose to do. And something like this marionette puppet shows, you know, how these actions take place. And then when we can actually see what that does to the rest of the body and how that all connects. So if you're ticking with your shoulder and then your neck goes the other direction, you know, what is this whole system? What exercise would we choose to help get out of pain? What soft tissue work would we do? So I love this idea of externalizing it with this marionette puppet. And this also helps us take into consideration the effect that these involuntary movements have on our muscular development. Like I mentioned, if we're ticking with specific muscles, I wouldn't necessarily uh, have us strengthen those muscles. And that could be pulling us out of a stable joint position. That could be pulling us into this tight cramped position. I'm using my shoulder as an analogy just because it's the most visible right now. And the reason I find this important is because I believe that people with tic disorders compensate in ways as unique as their tics. So it really does become a little bit of a body puzzle to figure out the best choices and the best workouts for your body. Um, and yeah, we can go into the next slide. So this one right here, this is the joint by joint approach. And this has been around for a while, but was really highlighted by physical therapist Gray Cook and strength coach Mike Boyle. Really great people to look into to further your own knowledge about movement in the human body. They're both absolutely incredible. But this approach can be used as a movement guideline for people with tic disorders. So if we think about that marionette, moving this whole structure in different positions. Maybe your shoulder goes this way, but your knee goes this way and your head goes that way. You know, you're putting yourself repeatedly into this constant position. And then the next day it might even be different. This is a great baseline to assess yourself. So we'll go through the whole thing. Starting at the very top, the blue means mobile. It should have movement. That joint should have movement. Red means it should be stable. There should be a coordinated effort to keep those joints in place. So if we start at the very top, that's your atlas and axis in the neck, that's the mobile part. That's what should be able to move. The lower part of your neck, your cervical spine, should be relatively stable. If we keep going down the spine, right in the middle, that's your thoracic spine, that should be mobile. That's where rotation happens. And then we're going to go out to the side. Those two red dots are your shoulder blades. Those should be relatively stable. Then we go out to the glenohumeral joint. That's what the ball and socket joint that we think of as the only shoulder joint. There's actually three. Should be mobile. Elbows should be relatively stable. Yes, it moves, but it moves this direction. It doesn't twist. There's not extra movement in your elbow here. Your wrists should be mobile. Fingers and hands should be relatively stable. We covered that pretty extensively in our first presentation. So if that's where a lot of your tic pain resides and most of your tics are, please go back and watch that one. And we cover this one, exercises and movements about that. But today we're going to keep going down the spine. So if we go through the neck again, upper neck, atlas and axis mobile, lower cervical spine stable, thoracic spine mobile, lumbar spine should be relatively stable. Your hips should be mobile, knees stable, ankles mobile, feet stable. So what happens is as things get switched, if we sit for long periods of time or if we tic in are getting pulled in different directions, this can flip. So let's say your hips become really stiff. Something has to become mobile. Maybe it's your knees that start to overwork and get a little cranky, or maybe that's where some back pain comes in because your back is overworking, whether it's flexing, extending, or rotating, when a lot of that movement should really be in the hips. The same thing happens with the ankles too. If we lose ankle mobility, something has to become more mobile. So maybe the knees start to work more, or again, even the back starts to try to work more. And so this is a great guideline to assess how your body is moving. So if you do discover a restriction somewhere, you can say, oh yeah, my hips are incredibly tight. Well, then you can make sure that the above and below are stable and then do some mobility exercises. That could be the first thing you look up, mobility exercises for the hips. And then you can start to see how that helps your body and tic urge intensity or frequency as well. So those are just the two themes we're revisiting. Now we get to get into the good stuff. Let's go and get into the next slide. So we're going to talk about the pelvis first, right? Most of the time when we're sitting, we're not actually sure, I don't know, nobody thinks about it as often. We're preoccupied with what we're doing. So the actions of the pelvis is here. When we talk about the hips, that's the ball and socket hip joints out at the side. The pelvis does several things. And this is why I think there's more variance in tic pain in the lower body. Tic pain in the upper body really isolates in a few areas, not everybody. But with the lower body, it's all over the place. And because the pelvis does so much, so it can tilt. And this is what I would want you to know leaving today, that the pelvis can tilt anteriorly, meaning that it tips forward, or it can tilt posteriorly. It depends on what your body has a tendency to do. If you think of your pelvis as a bowl, that will help give you a visual for this action of what it's doing. When it tips forward, imagine that that bowl is pouring water out forward. And if it tips posteriorly, that water's pouring back this way. The pelvis can also rotate both sides. So again, if you have a hip torquing tic, that's what's going on there. It can elevate, one side can go higher. It can depress, one side can go lower. Again, it can do that on both sides. And with all of those different actions, where should it be? What is a neutral pelvis position? Neutral is a range. We're not meant to be in any one position, but neutral is a range where we're looking at the relationship between the back of the pelvis and the front, and those are relatively level. The back will be a tiny bit higher, but we're looking at this range here, and that will help to stack the rib cage above. And we'll get more into that in a minute too. But where the pelvis situates also dictates how all of the joints below move. So let's go ahead and go into the next slide. So again, we were talking about neutral being a range. There is a natural curvature of our spine. It should have natural curves. Now those can be accentuated. And oftentimes, so if you look at that skeleton with the shadow behind it, that's in a heavily anterior tilted position. you can see those bones in the back and the bones in the front and how they're tipped forward. And what that does is that would compress areas in the lower back and tighten those lower back muscles. So learning that pelvic position, even adjusting that, does that help with pain in your body? And is that a tic that you have? If you're ticking forward like that, now you know, first of all, that you do that. And then there's options to help stabilize your lumbar spine, mobilize your hips, and neutralize your pelvic position. Um, and then other things to think about. What is your pelvis doing when you stand like that? What is your pelvis doing when you're sitting? As most of us are sitting here watching this, I can tell you right now, I am actually kind of slouched, just so I can be in screen, but I'm in a posteriorly tilted position. What about when you're lying on your side on the couch watching TV? Is one hip hiked and the other one depressed? And what about if you're sitting cross-legged? Is that rotating your pelvis? And that's important to know because now when you think about that's just your body's tendency, what happens when you put your tics on top of that? And how does that work against each other? How does that continual tight muscles? How does that change your mobility? So all of a sudden, we have some things that we can actually grab onto and make some different choices about when we can choose to move our bodies, what we would choose to do. Let's go ahead and go into the next slide. So this pelvic position and back pain, again, what is your body's tendency and what tics do you have in that area of your body? So knowing that, we kind of can think about those exercise choices right in that middle graphic there, that would help satisfy the goal for both of those things. So an example would be, and I had to write some examples down here. Let's say you're a runner with an anterior tilt, kind of like in that first, not first skeleton, but the skeleton that we just saw with a heavy anterior tilt. Let's say, so you're a runner with an anterior tilt, but you have a hip twisting tic. I probably wouldn't suggest that you do Russian twists. That exercise is when you sit on the ground with a medicine ball and you bounce it side to side because you're already in a rotation. And so now all of a sudden, if we add this muscular rotation side to side, you're really just torquing that area even more. That might increase your tics because you're making those muscles stronger. I would choose areas that derotate the pelvis, that stabilize your lower back, and then start to balance out your posterior chain. Let's say another example here. If you have a kicking tic, any which direction, and you have pain in the front of your hip, I probably wouldn't be giving you lunges. Lunge is a very great exercise, but it's a very heavy quad exercise. And if you're kicking, you're using that quad and we're kind of priming that muscle. What I would try to do is look at the range of motion of your hip and see if there's anything there that we can increase and restore that range. And then I would work on the backside muscles, your posterior chain, to kind of get you out of that forward position that you're doing so frequently anyways. So a big tangent here. I'm really not going to dive into breathing in today's talk, but it is a huge component of I believe working out and managing tics in general, decreasing tic urge, intensity or frequency. So the tangent is the pelvis is the bottom portion of your breathing system. And they've been proving that rhythmical diaphragmatic breathing helps to promote a parasympathetic response. Parasympathetic response is part of your central nervous system that helps rest, relax, and digest. And what I'm thinking is that when we're ticking, we are not in this rested position here. So to help promote this parasympathetic response, breath work is incredible. And I know a lot of us are really burnt out and being told to just control our breath, slow down our breath, but there's other ways to do it. And there's muscles that help control your breathing. If you have any grunting tics or even stomach tics, breathing tics. I know a lot of, present company included, a lot of breathing tics. So when we look at the musculature that does that, again, we do this same process. We look at the joint by joint guideline and we work on what part of these muscles are not coordinating the most optimal way. So again, your pelvic position can help optimize how well you're breathing, whether you're in a hard posterior tilt, whether you're in an anterior tilt, whether you're just squeezing your stomach all the time or pulling your belly button into your spine, thinking that that's stabilizing your core. That's a very old cue that doesn't really take into account intra-abdominal pressure. I'm throwing words out that we're not covering today, but we will cover in hopefully in future talks as well. So anyways, knowing your pelvic position, really important for parasympathetic response for a couple people that asked that in the registration questions. And then pain as well, hip pain, knee pain, back pain, pelvic position, really big indicator of that. Let's go ahead and go on to the next slide. And I know there's questions on like specific exercises. We will get there. I do have those for us too. So pelvic position and hip mobility. So your lower back and core stabilizer, I'm sure you might have heard those words before. We have a lot of different core abdominal muscles. And everybody, not everybody, but a lot of us, the first thing that comes to mind is the rectus abdominis. That's the six-pack muscle. That is a really superficial muscle, does not stabilize the core. It flexes the spine. What does stabilize your core is your transverse abdominis. And so if you look at this image, it kind of cuts away at all of the different layers of abdominal musculature. If you look at the fibers that are running side to side, it's the deepest layer in there. That is your transverse abdominis. That is your lower back stabilizer. And depending on what your pelvic position is doing and kind of what the hips are doing as well, that's the muscle that we have to learn to engage. It is so deep in there. You can see from this image, it might take you 2 weeks of doing transverse work before you even feel it. It might take another 2 weeks before you can actually start to actively engage it. So that's why we remember Luke. Learn how you understand movement. This is the keep going part. Keep going so that your body can adapt to the exercises that you are choosing, that muscles that you are trying to engage and strengthen. Keep going and it will be effective. So again, if we go back to this joint by joint approach, if the lumbar spine should be stable, then the hips should be mobile. So if the hips are not mobile, look at that ball and socket joint. That is the same type of joint, ball and socket, as the shoulder as well. They need to be both mobile and stable. Stable doesn't mean stiff. Stable doesn't mean tight. It means there's a coordinated effort of all of these pieces and structures around it to help it stay in one position through whatever movement you're trying to do. So, and we like to call the transverse abdominis the belt of stability because the fibers run that way like a belt. So again, little asterisk at the bottom, the importance of the glute medius and intra-abdominal pressure that help with this belt of stability as well. Today we'll just focus on some transverse work though. We can go to the next slide. Here are the exercises. So what do we do to help with pain? What specific exercises? The first one is a couch stretch. If we're in an anterior tilt, and a lot of people that are sitting all day, the quad muscle, the hip flexors, these front leg muscles get really, really tight and pulls you into an anterior tilt. So this is a great stretch to help work with that. The abdominal marching is directly working on your transverse abdominis. The one thing I didn't film in this, which is a great cue, if you don't know how to do a posterior tilt, if you get a towel and put it under the lower part of your back, when you're laying, so we're talking about that second exercise, abdominal marching, if you put a towel underneath your back, try to push your lower back into the towel, and then have somebody gently pull that towel while you're doing that exercise, you might feel when you lose that posterior tilt. It's a really great cue to keep you in that position. Why do a posterior tilt in that? It's just a very quick way to feel that transverse engage. A stick hinge, that is teaching you how to keep a neutral spine while your hips are doing the work, how to keep those hips moving and the lower back stable. And then the last one comes from a DNS certification, again, which I absolutely love their methodology. And it's a side roll. And it's a way for this whole, imagine that picture of all of your core musculature, all of that working together through rotation. And so we can go ahead and start playing those and see what it's all about. I don't know if I can hear it. I wonder if I have to mute.
You said you can't hear it? Just one second.
I'll mute my screen and maybe let's try again.
Nope, no problem. Just one second. I'm gonna momentarily stop sharing and I'll bring it right back up with audio. Thanks for bearing with us, everyone. My apologies.
For the couch stretch, you can use a couch, a bench, or a chair. You're going to get into a half kneeling position. Make sure that you're not tipped forward like that, but that your hips are tucked underneath you. That's going to increase the stretch on your kneeling leg hip flexor. If you'd like a little bit more, you can extend your hands overhead and then reach away from your kneeling knee. This is a great stretch for the quad and your psoas as well, but your body position here is really going to dictate how much of a stretch you get. If your knees are too cranky for that or we're not ready, then try this version where we're still in a kneeling position, pelvis tucked underneath, and then lean forward and away from that kneeling leg. This is a great stretch if you have a tendency to use your quad for everything, or if you sit a lot, or even just tick with that quad a lot. This is a great thing to do to open up your entire anterior chain. The most common mistake is having too much of an arch in the lower back and then just falling into the stretch. You need a posterior pelvic tilt and then lean forward into the stretch. That's how you'll find that stretch in that front hip flexor.
Ready for the next one?
Lay on your back and first let's establish your intra-abdominal pressure. Gather your rib cage together and drop the rib cage down, not up and through the chest, but the rib cage should be down. Bring your feet up into a tabletop position, pulling up on your abdomen and alternate tapping one heel down to the ground. You should be able to breathe normally through this, keep your collarbones wide and maintain that intra-abdominal pressure. This is undoubtedly my favorite conversation to have with people, the stick hinge. Place a stick along your spine. The stick should touch the back of your head, in between your shoulder blades, and on your tailbone. As you travel your hips backwards in space, try to maintain those 3 points of contact. If you round too far forward, you'll lose it on your tailbone. If you keep your legs too straight, then it's just going to fly all over the place. Or if you're overreaching your ribs forward, you'll lose it in your mid-back. I cannot emphasize enough just how important this move is and how many inlets there are. What are your feet doing? How are you breathing coordinated? Can you actually feel the right muscles? How is your spine stacked? There's so much that you can do with this movement if you give it the time and the patience. Start out on your back with your feet in tabletop. Abs are engaged to support your legs back. Lower your left leg toward the ground and roll onto your forearm. Pause and roll back down. If you're rolling to the left, your left leg lowers first. We're looking to build a connection from your shoulder to your hip. Common mistakes are to collapse into the shoulder, causing the midsection to sag. Plug your shoulder in and keep your midsection like a cylinder. This is a great exercise to learn about ab tension and how it connects to your shoulders and hips, and how to stabilize each of those parts. If you're feeling connected, try it with a block or a shoe balancing on your hand. If you're ticking a lot, don't forget to breathe. Breathing is the magic of this exercise.
You're on mute, Raquel.
Cool. Great with bodies, terrible with tech, but here we go. So hopefully that answers and can actually help some of you with knee, hip, or lower back pain. So let's go ahead and move on to section 2. Next slide.
For the couch stretch, you can use a
Lay on
couch,
your
a
back.
bench.
Yeah, I talk all at once now.
Yeah, my apologies.
So now foot root. What the foot does is connects our kinetic chain from the ground up and kind of sets the stage for how the rest of our body is going to move. So first clue would be to look at your shoes. And do they wear evenly? Like, do you wear more on the side, or does your toe pop out of your shoe like mine does? Do you wear more on the inside? But it's kind of a a blueprint for how you're stepping with each step. Is it even, or are you rolling out on the side? Are you pronating? Do you wear out the inside of your feet first? And this is important because, again, how your foot is moving and operating sets the stage for how everything is moving up above. There's the role of the big toe. Your big toe, incredibly important for balance and glute activation. So how do we get our feet to do this so-called foot root? And we need to be able to spread our toes. That's what's going to help stabilize. The more stable our foot is here, we can have a mobile ankle. And again, we can have too mobile of an ankle too. So we would have to stabilize throughout an appropriate range of motion. But again, this whole system, your knee is going to follow what this does. And your knee is also going to be the result of what your hips are doing. So anybody with knee pain, it's an in-between joint, and I would highly suggest you look at your pelvic position and what your foot's doing. So let's talk more about that and go ahead and go into our next slide. So foot rooting with hip and knee pain. It sets up this lower body chain, and so we kind of think about what that would do to the marionette puppet. Lots of studies on going barefoot and training barefoot, and a lot of emphasis on kids, not wearing the wrong shoes. But what about us as adults? We love heels and boots and dress shoes. We're not often thinking about our shoes for functionality or comfort first, then cuteness. Sometimes it's both. Shoe technology has come a really, really long way. And if you get the wrong shoe for your foot, it makes a difference. I tried a very, very popular brand of shoe and it made my foot go numb, and everybody was raving about it. I'm like, not for me. So again, make sure that you look at your shoes, how they're wearing, and make sure you get the right shoe for your feet. So foot rooting is getting this solid foundation with the floor by maintaining a tripod. What we mean by that is your big toe pushing, your pinky toe, and then your heel. Hide that thumb there. That's the tripod of a stable foot. And if you're doing exercises, let's say a squat, and you're rolling outward this way, if your feet roll out, that's called supinating. And if they collapse in, that's called pronating. And there's a big effect if we pronate, let's say when we run, what's happening to our knee up above? It's probably coming inward, and you might get some pain on the inside of your knee or the top of your knee. If you have really, really high arches, what does that do to the rest of the kinetic chain? If you have flat feet, that really encourages that pronation. And there's things that we can do for our feet. So let's go ahead and go on to the next slide here. So foot rooting and these lower body spirals, basically. We talked about the hips being ball and socket joint. They rotate a lot. Now we've just learned about the foot, how it can fall inward and how it can roll outward. You can be a toe walker or a hard heel stomper. What happens is with these feet that are doing whatever it is that they're doing that we're not aware of, and this hip joint, let's say your particular hip turns in a lot. Well, this connection, look at that poor knee in the middle, that's the result of whatever's going on here. So if you're running with this, and that's just your body's tendency, depending on how you tick will affect that too. But knowing how this all works together should actually be empowering for, we can make better exercise choices. Think of that, those two circle graphics with the exercise choice in the middle. Boom, that's your call to action for your own body. So let's say I have some other examples here. Let's say you're flat-footed and you have a hip twisting tic where you rotate in that direction and your foot's flat here. Well, again, let's say we go back to you just want to do some lunges at the gym, popular exercise. Well, if your foot is in that first picture there with the kid with the Band-Aids, that's a pronated foot. You can see how that knee is collapsing inward into a valgus position. If you do lunges on that, well, the inside of that knee is not stable anymore. It is decentrated because it's being pulled to the inside here. And then the hip, as a result, up above, might be getting a pinch in the front. So it's not don't exercise, it's maybe wait to do lunges. Maybe we have to address the feet. Maybe we have to address the glute medius and work on the connection between them. So looking at the middle picture, you can see the feet are slightly turned out, but one of them a little more than the other. You can look at the ankles too to see if somebody's collapsing inward. And then that other picture, this is why I think there's so much more variance in lower body tic pain, because the way that the pelvis moves and the result of the hips rotating in different directions and how that goes up and down. So there's different stances that you can play with and figure out what feels best for your body. Parallel is just standing hip distance apart with your feet relatively straight. You can do turned out. We often call that the sumo style. If you have really tight hip flexors, that's a really great option to try first. Pigeon-toed, inward. There's actually a time and a place that you might want to do exercises and activities with it turned in. We want to train in different planes of motion. For this, I'll talk about that in a second here. A staggered stance is 1 foot forward, 1 foot back. So splitting the load this way, that can actually take pressure off of your back. Let's say you really love doing overhead presses, but you feel that pressure in your lower back. You can try it with a staggered stance. You can do things single leg or half kneeling. So there's all of these different stances that you can play with to make it right for your body. Let's go into the next slide. Actually, sorry, go back one for me. So I mentioned here in the lower body spirals, you can see in that last picture there kind of what's going on. That's simply the result of this rotation that happens throughout the body. There are some great cues out there. When you put let's say you're in a parallel stance, to root your feet into the ground to stabilize, we oftentimes thinking about a corkscrew where you're pressing down in your tripod, but then the rest of the leg is corkscrewing outward. And what that does is it pulls the hip in a centrated position while rooting the foot. That kind of gives you a stable position. And then depending on the exercise that you're doing, that's really a setup for a squat or a Bulgarian split squat, something like that. But this lower leg spiral is a really interesting look at this whole kinetic chain here. All right, so again, what do we do about that? Let's go ahead and go on to the next slide. Here's what we do. The first one, foam rolling your calf. Tight calves and tight backs go hand in hand. And then kind of common sense here, talking about your foot going in different positions. Well, what's the next muscle up? That's your calf. It gets very, very tight. Foam rolling is a great way to do some soft tissue work. We didn't even really talk about connective tissue, but also a good tip, if you can't sleep very well, try foam rolling your calves or stretching your calves at night. Your calves actually function as blood circulation, right? When we're standing, blood goes down. Your calves actually do work to help pump blood up. So if you can't sleep at night, try working on your calves and see if that can help get you back to sleep. Finger toes. There are some great products out there to help with the toe spread, but you can do it yourself. You just stick your fingers between your toes and it separates your toes. You will feel a difference between doing one foot and the next. It sounds really weird, but it has been a game changer. Banded toe squats. This is a very simple way. We talked about these leg spirals and maybe that's making your brain spiral. How the heck would I do that? This is a really great exercise that encourages it without you having to change, do, or think about it. It just kind of naturally happens because it gives you something to push against and it puts you in an appropriate leg spiral. A single leg RDL, fantastic for single leg strength, balance, and power. And you get to work on the hip moving because it's a hip hinge position. Your knee is just going along for the ride and your foot would be in that rooted foot tripod position. And so we can go through those and see what we think.
Place one calf on top of the foam roller and your other foot on top of that leg for extra pressure downward. You can move up and down, side to side, as shown here, where the two calves overlay, or you can go up higher towards the bottom of the knee. Let's talk about making some space between your toes. What you're going to do is pick up one foot, cross it over the opposite knee, and interlace one finger in between each of your toes, making space between them. Then we're going to move your foot in different positions. We can rotate your foot from side to side, and you can see here just how much movement is in the foot. Then you can also flex your foot up towards you and then down away from you. Flexing it up towards you really stretches out some of those areas underneath your foot you might not realize are tight. You can also do some ankle rolls in both directions. After you're done, you'll notice a very big difference from the foot that you just finished and the one that you haven't done yet. Let's work on setting up your foundation from the ground up. This is great for any toe tickers, knee tickers, or hip tickers. Basically anybody who ticks with their leg. Go ahead and get a band and step into it. You'll adjust as need be, and then you're going to loop the band around each of your big toes. Adjust the back again as need be. Go ahead and stand up hip distance apart, and the band here is encouraging you to keep even pressure, not collapsing in like that, and then we're not going to exaggerate it by rolling on the outside of our foot. No toe scrunches, but it kind of encourages a foot tripod. Pressure on the big toe, the pinky toe, and the heel. And then with that even pressure, we'll do squats. How does having this tripod make your tics feel? There's also another variation to this. Again, get a light band, but this time you're going to loop it just around your big toes. This might be a little more intense. I prefer the other one because I like having the whole ankle involved, but by all means try this one too. Same thing, don't collapse in, pronate, don't supinate out, no toe scrunching. We want that beautiful foot tripod. That's your connection into the ground. We are doing a single leg RDL, Romanian deadlift. It is a hinge-based pattern. The hinge means that the hip is traveling back in space. Your shin should stay vertical and your hip should stay squared. Your squared off hips means that both hips are facing the same direction. Don't let that one hip open up bigger. A vertical shin is true on every single deadlift, a double leg deadlift or a single leg. What we should be feeling here is anything on the back side of your standing leg, your calf, your hamstring, your glute. Your shoulders are still set here. If you're having any shin pain or any foot collapse or arch pain, send me a video.
Was trying to answer some questions in the meanwhile there. So we've dropped a lot of information, a lot of terminology, anatomy. So again, above all, just remember Luke. Learn how you understand movement, keep going, and it will be effective. You have to find out what the movements are that your body can feel, either a relief, a reduction in pain, in reduction in tic urge, a reduction in tic intensity. But we've got to keep going to figure out what it is that your body needs. But there is a way for you to move your body and help it feel better. My biggest thing is that your body has to feel it. However, we can get you to feel it, there's a downshift that happens. That's where all of the parasympathetic stuff comes in, because now all of a sudden it's practicable. So above all, just remember Luke. This presentation is going to be up. You can always come back and refer to it. Any of the other ones that we've done, that's kind of why I throw too much information on there, so it can be a resource. But what you have to do is remember our dear friend Luke. Next slide. Your takeaways. Pelvic position. Anterior, posterior, neutral. How do we get it neutral? Foot root. Big toe, pinky toe, and heel. That's your tripod. And we're just going to remember Luke. So hopefully all of that makes a lot more sense. Not such a daunting thing, but onward we go. I think that's all we have for you today. I'm so grateful that I could have been here to do this with you guys. And if you have any questions, please don't hesitate to ask.
Amazing. Thank you so much, Raquel.
Yeah.
I know that you have been checking out the Q&A section, but before we start that, just really
Yeah.
quickly, I'm going to leave up this slide for about, 3 or 4 minutes. What we ask is that you please kindly use your cell phone to scan the QR code and access our post survey for this program. Not only do we greatly appreciate the feedback, but your feedback does directly help us to make not only future programming in general that the community is looking for, but also future programming for our adults as well in general. So thank you so much for taking the time to fill this out in advance. If you have any questions about accessing it, feel free to place that in the chat as well. I know sometimes tech can be Yeah, just a funny thing per se. And then in the meantime, Raquel, if you'd like to get started with the Q&A just while I have this up, and if you could see
Yeah.
it, that's great. If not, just let me know and I'll be happy to give you our first question.
Yeah. Something else too. So I was at the TickCon this past year in 2024. That's actually how Alexandra and I met.
Mhm.
I did do a presentation there on the entire spectrum of training and how I think tics can be accounted for within that. And so I wasn't one of the ones recorded at TickCon, but I did actually go back and dub over that exact presentation. You can find that on my YouTube, but that might also help kind of explain, I mean, the just training in general and training with tics, which is something that we all here get to deal with, so and work through. But so yeah, some of these questions. How would walking flat-footed affect lower tics and tick pain? So we did kind of cover that as well when you're flat-footed. And again, the question is, or I'm sorry, the answer is always it depends. There's a lot of other variables that we need to know. But being flat-footed, depending on where your tick pain is and what the tick is, but if you're flat-footed, it kind of puts you into an unstable hip position anyways. So I'd work on your feet, I would work on your foot rooting, and I would work on your hip stability. That's kind of what I would do for that one. Another question about flat feet, that exercise that we showed there with the band around the ankles, because what happens with that one, if you put your band around your ankles and loop it around your big toe naturally wants to push down and the body doesn't want to fall down. So by having the band on the outside, your ankles naturally want to push against it, and that actually helps create a lifted arch. I just did that with a client earlier today who has incredibly flat feet, and it still gave her that little baby arch. So we're going to keep going in that direction. How would walking more on your toes affect lower body tick pain? Depends on the tick and depends on the pain. But if you're toe walking, you're still not in a centrated position. What that might do, walking on your toe, is actually put more of a shearing force on your knee. So that depends on, again, where the tick pain is. But that also might mean that you have a pretty tight calf. So I'd foam roll that calf and see how that feels. There's also another exercise if you're a toe walker. It's called an anterior tibialis lift, where you basically lean against the wall and you lift the front of your foot this way. Because now all of a sudden that's dynamically working this part, which is the opposite of toe walking. What else do we have here? Let me see. There were some other questions on here too. One of them being, how do you tell people, work colleagues, friends, other people that you're close with? Personally, I used to wait, and I noticed this about myself, about 2 years before I would tell anybody about it. It was just a pattern I recognized starting in high school. I'd wait 2 years. Then my senior year, I would tell people. And then my sophomore year in college, I would tell people. Now I feel pretty confident in letting people know that it's a condition I have. It's an uncontrollable urges to tick. And I mean, kind of just as confidently as that. It's not anything anybody can catch. It's not anything that I have control over. I've learned to manage it over the years. Is it annoying sometimes? Yes. You have any questions about it? No? Okay, if you do, ask me. But with that, let me see what else. A lot of questions on pain management. When is it necessary to consult a doctor for pain? I mean, if it's severe pain, yes. Can we hurt our bodies from repetitive tics and damage tissues, joints, things? Yes, we can. These are uncontrollable repetitive motions. I mean, physical therapy really focuses on overuse injuries, in addition to, of course, acute things, but overuse injuries are a thing. There are, exercise protocols in place for overuse injuries. But again, for people with tics, I think that we compensate very uniquely to what our tics are. So it might be a great idea to reach out to an OT or a physical therapist that focuses on exercise and movement. If they're just there just to massage it and put a heat pad on, I don't think that's enough. And I might get a second opinion from some other medical professionals. Techniques for relaxing, breathing, and stretching. I think maybe we'll do another one where we really get to dive into the mechanics of breath work, because I think it's huge. And I think if we can approach it anatomically, it might make more sense to those of us that tick. Again, I think a lot of us are kind of burnt out on being told just to slow our breath down. Does it work? Yes. But what if you can't do that? There's other things that we can do. So that's kind of a longer, deeper conversation. But the cool thing is there's trends that start to happen in the fitness world, and breathing is becoming a trend. Is it always correct? No, but the fact that we really get to dive into this plethora of breath information, I think is amazing, and something that our community can really truly benefit from, especially if we study it some more. All right, so what other questions do we have here? I presume the potential long-term impacts of persistent repetitive strain injury. Yes. I think a lot of us are worried about kind of the repetitive injury. And can it happen? Yes. What can we do about that? Not train the muscles that are doing the repetition. We would want to train the antagonistic muscles to help create a centrated joint. So depending on what it is, since we're talking about the lower body, let's say you kick your knee up at the bottom of the desk constantly, and you've really got some hip pain in the front. Maybe you're worried about a labral tear or something like that. There are different protocols for that type of overuse injury. I don't think worrying helps us in the now. It just kind of takes away from the now, but we can prepare and we can plan for something that we are currently doing. And that would be learning about your body's tendencies and learning about different ways to exercise. And that's kind of the quest that I'm on, is I would like to get more specific about this. Let's see, what can you do if your feet are pointed out, the opposite of pigeon-toed, and on the side of your feet? So this turned out position, basically you're kind of doing the opposite of a leg spiral. Because if we're standing out like this, the body is amazing at compensating. Does it compensate in the way we want to? No, but its ability to adapt is really incredible. So if the feet are turned out like this, the first thing I would suggest is look at what your knee is doing. Because if your foot is out like this, and then your knee is like this, it doesn't even make sense. Let's pretend that this is the kneecap and it's turned like this. Well, there's a weird torque that's happening now between foot and knee here. So we can start to play with different positions here. You can start to play with this leg spiral, and then look at how you can get your hip musculature to work that as well. What else? How are we doing on time? We're probably right there, huh?
Yeah, I think we have time for one last question. Perhaps the last one. I think it might be really helpful to the audience. It's from Sabrina, and she asked, will these exercises assist with ticking in my sleep?
And that one's crazy hard to answer because nobody knows how much we tick in our sleep. I do deal with very serious bouts of insomnia as well. I hope so. There are studies out there that look at just exercise in general and sleep, and usually it's overwhelmingly positive that people that exercise have better sleep. It depends on when. If you exercise in the morning, maybe you sleep better at night, versus if you exercise closer to when you go to bed, that might kind of ramp you up a little bit. So the time of day that you exercise can affect your sleep. And if you have trouble sleeping, again, the first thing I would suggest is try stretching your calves, massaging your calves, or doing some foam rolling on your calf, and see if that can't help you get back to sleep. I wish happy sleep for all of you. It's very important.
Amazing. And I will say, first and foremost, Raquel, thank you so much for joining us again for another amazing programming. This is one of many adult programs that we have, and they all interconnect, and we do have one on sleep. So just, just because Raquel's saying, hey, some of that is really just up in the air and not exactly something I can give you an answer on, please feel free to check out on our YouTube another presentation that specifically goes over a little bit more of items related to sleep as well. And please feel free to check out Raquel's part 1 to this that she did with another co-presenter, but was on reducing upper body pain that she mentioned as well. Thank you all so much for joining us. And I will hang on for a minute as folks leave in case there's any other questions, but otherwise, we hope to see you very, very soon at another one of our adult programs. Thank you so much.
Awesome. Thank you, guys.
Thank you. And I will stop our